Okay, today's medicine. Let's see if I can say this thing. Aristolochia, clematitis. Aristolochia clematitis. Okay, so uh, by the way, I'm going to put a link in there. Saturday, I'm doing a Zoom call, and it's only a half hour. I'm really just trying to get used to Zoom, but I'm going to give some valuable information on what is it, the problems that we go through today. Different things like arnica for the head, different types of things like that. If anybody's interested, I'll put the link in here in my comments section. You can come there Saturday, ask whatever questions you want. If it's just all questions, that's what I'll do. If it's oh man, I hope I didn't get another tick. Yesterday I wore my shoes all day yesterday, and then my toe was itchy. I think, oh, I got poison ivy. I look down, there's a tick between my toes. Now, that has to be coming off these 6 cats or 1 dog that I have. Because it wouldn't be on there from my feet all being in my boots all day. So I'm going to answer questions, but I do have a curriculum that I'll go through real quick, but the main thing is just to get people in there, me to get used to using Zoom. And then once this first one, I may do one every Saturday, just have people come in, ask questions, even about your health. I'll be glad to direct you. I'm not a homeopath, so I do not give medical advice, but I can direct you to medicines that can work for your situation if you want to try it. So, aristolochic acid is what it is. That's why it's Aristolochia, and it comes from a plant, but um, clematis sounds more like a plant. That there's a plant group of plants that's like clematis. Man, I think that was another tick. All right, so subterranean part of the plant, which is the root, must be emphasized here. It is toxic and an irritant as well as a stimulant of vagina, whatever. It is a yellow, bitter substance. Okay, so this they're isolating this what is that acid called? Arist aristolochic aristolochic acid. So it's got to be Aristolochia. Yeah, clematis. Clematis, that is a plant. I don't know which. Yeah, I don't know which one that is right now. But aristolochic acid is what they're using here. They're isolating it from the root of that plant, and they're making a homeopathic medicine out of it. Aristolochia clematis of the there's a whole group of plants that are Aristolochia the family. Anyways, the family of those plants grows in southern Europe and South America. Its active principle is clementine. Hmm. Interesting. Which is identical to the Aristolochia or the serpenterin. Oh, you don't need to know that. Non-purified. Okay, aristolochic acid causes menorrhagia, which is bad menses. Tends toward miscarriage and has a toxic action on the kidneys and liver. So, with the principles of like cures like, all those things, the kidneys, it's got to be good for the kidneys. Any miscarriage, this may help in miscarriage. There's a few remedies like that. Menorrhagia, liver problems, as well as intestinal mucous membranes. It'll hit all those. So if anybody's having a problem in those areas, you would consider this medicine because when they gave this medicine to people, that's the symptoms they got. Aristos, they just call it Aristos. Aristos means better. So, yeah, better. Lochia means giving birth. Okay, so better giving birth. So that's the miscarriages. It'll help with the miscarriage. And like I said, there's a couple medicines like it. In popular medicine, which popular medicine is what we use today pretty much, in popular medicine to induce birth or stimulate the menses. So to get the menses flowing or to get the birth, if they're having a baby to get that to start moving. Also as a diuretic, and against rheumatism. So any kind of arthritis type of stuff. In high doses, it is an emetic and cathartic. So I'm not going to get into that. In South America, some Aristolochia are used for blindness. So yeah, I mean, you got a blind person, why not give it a shot? Can't hurt. The provings by Mesger made use of the spring rhizome. So that's the plant coming up and all that. The experiment was carried out by 18 provers, of whom 13 were women. So I guess 5 were men. The following potencies were studied: 5x, 12x, or 2x, and 12x. And the mother tincture. They even used that. The experiment lasted for 12 weeks. So this is, all them symptoms I just mentioned to you, the kidney, the menorrhagia, the miscarriages type of, yeah, I don't know how they figured out miscarriage, liver stuff, intestinal stuff, all that was, that's where all these symptoms came from, them doing a proving on it. Subjects of nervous constitution with extreme sensitivity who cry easily. So that's, yeah, it sounds like sepia and all those other homeopathic remedies for a lady going through hormonal imbalances. Tubercular conditions of the worn out type. Okay, so Aristolochia clematitis. Birthwort, it says. Oh, that's interesting. It's birthwort, so it helps with birth. So they call it birthwort, the plant, I guess. Excess of estrogen. So that's where a lot of this stuff will come from, is the excess estrogen in the body, and this will help normalize the estrogen. Urinary, kidney, venous system. So the veins and the urinary system, very good for it. Worn out with vertigo and chilliness. That's a 3. So you see a patient that's just totally worn out and they have vertigo and chilliness going on. You would consider Aristolochia. Hey, I got it right this time. Clematitis. So you got a worn out person, just like the lady that from Germany. She said, what did she say? She said she doesn't want to go out and do nothing. She doesn't want to take business, and she was just worn out from all the years of stuff. Carb helped to, helped her to. She said she was 30% better once I gave that to her. So it helped her to be able to go out and take care of business, and if she keeps taking it, she'll get to 50%. And like I told her, as once you take this, there's a layer there. And once that we get through that layer, you may see a whole nother picture that you need a different set of remedies to get, so, most people aren't that serious. They just, hey, look, I'm having a hard time going out and doing functioning, and you get that better and they're like, okay, bye. Or I got a bad knee. I gave a friend of mine a bottle of water with bryonia in it. Knee's better. Her husband has a problem, and I said, hey, why don't you let me take a look at my buddy? He was a friend of mine for years, and they're not even considering it, because he's got a really bad disease. Where they don't realize, taking care of a knee is one thing, but going into that thing, whatever he's got, I forget what he's got. Anyways, and doctors, they give him a medicine and he's on that forever, and I guess it helps with whatever he's got going on. But if he'd come homeopathic direction, we'd probably be able to neutralize what's going on with him, and he won't need medicine anymore. So during menses, better during menses. So before the menses and after the menses, it's worse. But during menses, so anytime the menses come on, it relieves all the pains, whatever, kidney problems, whatever's going on. It relieves it. Better from eliminations. So this is what I say, you can either have a leak in your vital force, which means energy's leaking, you got pain there or whatever's going on, you've got an energy leak. The other end of that is congestion, where, whether it's the sinuses, the vagina, the anus, there's a congestion where nothing's coming out and it makes the whole body sick. Just like my son with his spleen, he couldn't go to the bathroom, and he was looking really weak and tired and just run down, and he said he couldn't eat. So once I gave him Illumina, that opened up the anus, started going to the bathroom. Next thing he started doing was eating. Then his countenance came up and his energy came back. So yeah, that's, you hit someone with the right medicine. That's how, and this was in, I don't know, I think he took it for a week. He bottle of water, took it for a week. That relieved all those symptoms. Now, I think it took a couple days and he started going to the bathroom. Then a few days after that, he was eating well. Then by the end of the week, he was looking, his countenance was looking good. His energy was back. But I told him just, he refilled the bottle and he kept taking it for another week or something like that. And, you know, once again, you get out of that state, I might have another state. But most people don't make it that far. They're not looking for long-term health. They're looking just to get out of this situation. So, uh, worse from suppression. So anything that's stopped up, your anus, your vagina, your nose, you're not sweating, things like that, that causes problems. And then everybody's always better when these things start flowing, like the menses or whatever. And eliminations like urination. Oh, the urine to the so if he starts urinating, starts going to the bathroom, having a stool, or the menses start, or the sinuses start draining. Most times the sinuses will start draining, and they'll be like, okay, we got to give you something to stop that. No, you don't want to do that. You want to work with the vital force to push out whatever the vital force is trying to push out, especially skin stuff. You got eczema, or you got something coming out of you. When you have that skin stuff, you start suppressing that. That's the body fighting, and the skin is the last organ to push things out. It's, if you got a kidney problem and it starts pushing something out of the skin, you put that something on there, or you take a drug to stop the skin stuff, it goes right back into the kidney. So the two things are asthma and rheumatism. So you stop the skin stuff and they get asthma. You relieve the asthma and they get the skin stuff again. So now you go for the skin stuff, relieve that, and now they have health. They don't have this problem back and forth. Same thing with rheumatism, skin stuff, depending on the person's constitution and who they are. You put something on the skin stuff, you take a drug to stop the skin stuff, and now they got rheumatism. You take care of the rheumatism, the skin stuff comes back. And, I remember reading about Dr. Robin Murphy, my mentor. He was taking care of a case, and I just remember that the guy broke out all along his stomach with a bad rash. And he said, listen, put, what is that called? Oatmeal. Oatmeal patches on there, take baths, or whatever it takes to not put like cortisone or some kind of crap on there to stop that from happening. And once it clears up, everything will be cleared up. So that's what this guy did. And, once that rash, so that was the body pushing out whatever internal stuff was going on, that big rash, it must have been very uncomfortable. And once that was gone, the guy had health. So that's kind of the way things work. Okay, they have the fear of future. They reject company. They don't want to be around people. They're worried about their future and what's going to happen. It doesn't say their health or anything, just their future. And they have psychosomatic problems, which is, mental issues, which is like depression and stuff like that. And especially at menopause, they get this depression, this psychosomatic stuff. And sepia is one remedy you would consider with Aristolochia clematis. I love saying them words. It's very interesting to try to get it right every time. But they, during their menses or menopause, they would have that. And even menses, when they're having before their menses and after their menses, everything's worse. So they have this psychosomatic thing around menopause, menses, all that kind of stuff. Sepia would be considered. Colic, spasmodic colitis, and colitis is another bad situation that a lot of people in this country are stuck in. And this is one of the medicines. Aristolochia is one of the medicines you consider. Abdomen is distended before and during menses. So they've got this bloating in their, and a lot of women will say, they feel bloated, and they have these, probably have back pains too, no back stuff. Interesting. But breast, pain and hardening of left breast. And this is good for cystic mastitis. So any kind of lumps in the breast, you'd consider Aristolochia clematis. Feels hard like breastplate, the chest does. And it doesn't have to be in a woman, but yeah, the chest feels like a hard plate. No ears, eyes, watering, aggravated by light and reading. So when they read or they any kind of light, their eyes begin to water. Burning and itching in the eyes. Let's see, what is this? Okay, this is all eyes. No, no, no. Female. This is all female stuff. Okay, so brown discharge. So, from a leukorrhea, they have a discharge that's brown. Watery flow, eczema of vulva. So they have skin issues on their vulva. Sensual itching aggravated before menses, ameliorated during menses. And after menses, it says they have that itching on their vulva, with the eczema going on. Menses are absent, late, or short. So they'll last maybe a day or something. They're too short. They come on late, or they're just totally absent. Blood is black, and that's where they're better during menses. So, and before and after menses, they're worse. Blood is black with clotting, so real dark blood with clotting. So now, here's all the things they got going on. Varicocele, I don't know. Enlarged veins, so that's varicose veins type of stuff. Cramps, which is dysmenorrhea, and amenorrhea, which is absent menses. This is cramps during menses, and metritis is the uterus is inflamed, and vaginitis is the vagina is inflamed. So there's a lot of, this is great female remedy. I don't know if it's because they just had mainly females. And this 18 people, that's not a big proving. That's why if it was in the mainstream, the what did they call it? The popular medicine. If it was in the popular medicine and they took and did a major study on it, that it's a shame that they separated the two disciplines. Like I was telling a girl yesterday, Oliver Wendell Holmes said if they would dump all their medication into the ocean, medicine would be a lot better. So, and that, I mean, listen to the commercials. They're all dancing and they're all happy and everything's fine. And then at the end, they're still dancing and they're telling you your liver will fall out. You may not be able to handle any kind of flus or colds and that. Your immune will be down. This and that is wrong. You have this and the other. And man, it's like, holy crap. Is the side effects any better than the actual disease I have? Where when you give a homeopathic remedy, there's no side effects. There can be if you overdose. That's why this is proving. They prove it, they get all these symptoms. Now they know if they give this medicine to someone that has any of these symptoms, it'll clear it up without side effects. Unless you overdose them, unless that's what the way they used to practice homeopathic medicine. They'd give him a high dose. Like I got a 10 m of the tick, whatever the tick's disease that they give you, the Lyme's disease. Those I forget, Barilla. There's two different sicknesses, viruses that bug gives you, bacterias. I don't know, but anyways, at 10 m, you give a 10 m to somebody that's sensitive, man, they'll get aggravated, they'll get all kinds of symptoms, and that's almost like when you give drugs and they get these side effects. But other than that, and you can antidote homeopathic medicine pretty easily. You just, they have in the books, they tell you this medicine will antidote that medicine. So, you got someone aggravated, you give them the other medicine, it clears it up. Now you can start over, go lower, and not aggravate them. And that's why Hahnemann went into water, because he was trying to find something that would for hypersensitives, that when you give the medicine, that wouldn't aggravate them, because even with the hypersensitive, you give them a low dose and they're getting aggravated. So he would put it on in like 4 or 5 glasses of 4-ounce water, and each time just take a little bit out of each one, and now you take the medicine. There's no aggravation, but it works better. But the deeper with the water, it goes in deeper. We are water, so you're, instead of throwing a sugar tablet in, you give them water, and it basically works real well. It hits every cell in the body. All right. Anorexia. So anybody having anorexia, Aristolochia, clematis would be one of the considered remedies. And when I say one of the considered remedies, is if you look up anorexia, and I didn't today, but there's probably, who knows how many medicines. You look up a headache, there's probably 50 remedies there. So you got to narrow it down to what's it feel like: throbbing, pounding, stabbing, they have different categories: right-sided headache, left-sided headache, forehead, back of the head. They have all these things. When you get that and you can narrow it down, you eliminate a lot of medicines, and you get down to only a few that you have to determine which one matches. So with anorexia, there's a few of them. I don't know how many. I didn't look it up, but you would have to consider which one matches the rest of these symptoms, or the symptoms of another medicine. So you're differentiating. One may be like cold, one might be worse cold. One may be better from movement, one may be worse from movement. So that's where Bryonia and Russ talks. The kid said, the person I was talking to said, yeah, well, online, they said, yeah, my son's knee is really killing him. And I said, hey, I can maybe help, so I don't know, she texted me or whatever. And I said, is it better when he moves it, or is it worse when he moves it? Does he want to keep it still, or does he want to get up and move? He says, oh, he wants to keep it still. Bryonia, worse by movement. Gave him Bryonia, cleared it up. I called her back a little later. I said, a day later or whatever, how's his knee? Oh, it's better. So that's how you kind of do it. All right. That's anorexia. They have nausea, vertigo with that, and a cold sensation in their body. All right, head. Diffused headache. Fresh air. I don't know what diffused means. I mean, I guess it's all over. It's not so clear or whatever. Fresh air and by cold. So they're better by fresh air and cold. Damp compresses helps. Congestive headache. Belladonna has the congestive headache. In other words, you're all congested up there and you have a headache. Belladonna or Aristolochia clematis, which is birthwort. No heart. Kidney, a lot of kidney stuff with this. Pain in kidney and bladder with frequent urination. Bedwetting, especially in older women. Incontinence, so that's that bedwetting, they can't hold their urine, and a compelling need to urinate. Colitis, cistitis, so cistitis is cyst on there, colitis is the urination stuff. Amenorrhea, that has proteins in the urine with white discharge, so there can be white discharge in the urine in that. All right, so arthritis is in women with menopause. So any woman having menopause, you may consider Aristolochia clematis. Rheumatism of the knee. So it doesn't say right or left knee, but any knee pain, rheumatism, you would consider this medicine. Legs are heavy before menses. So the legs feel real heavy. Joint pain, better movement. So that's a Russ Talks symptom. So like I say, Russ Talks, they're laying there and they're stiff, and they feel like, they have this pain, and they get up and they move around, and it's hard to move at first, and then they start moving and it loosens up and it feels better. So this joint pain is better by movement, aggravated in the sitting position. Sulfur don't like to sit or stand, so that could be a sulfur situation. Varicose veins, worse menses, before menses. So their varicose veins really hurt or are prominent before their menses. So before the menses, they're having a lot of stuff going on, and after the menses. And once the menses come, they feel a lot better. Bronchitis in the lungs. So this is one of the bronchitis remedies. Angina, which is heart stuff. One of the heart remedies, could be for the heart, laryngitis with hoarseness. So if you have that laryngitis with hoarseness and bronchitis, you'd consider Aristolochia. Morning cough. So they wake up and they got a cough. Thorax is painful on the left side. So the thorax, you have a painful left-sided thorax. Male, nothing painful. There was 3 males or 5 males in there. I don't know why there's no male stuff. I guess it doesn't affect the males as much. Painful with cracked mouth is painful with cracked corner of lips. So anybody having cracked corner of the lips, that's why I say you always look at a person's eyes. You look at their mouth. You look at their shape, whether they're heavy or thin. You look at their eyes, what color they are they yellow, or they, bloodshot, or you look at their tongue. These things can start guiding you down the right path to the medicine you need. Teeth are painful, aggravated by cold food, which, is kind of normal. Ameliorated by warm food. That's a little bit strange, because usually it's aggravated by any food that comes in, or any water, or any cold stuff. But this is aggravated by cold food and better by warm food. So this person definitely wants warm food. Sinusitis, that's that congested headache. They'll have that congested headache, belladonna, sinusitis, all stuffed up there. Coryza is a thick mucus in the morning. So, they're waking up in the morning coughing with this thick mucus, and that could be postnasal drip, going down in there, and they got to cough it out. Better by getting up. So they want to, sit up, because they feel they're all stuffy and that, and it gets better when they sit up. Better by fresh air, and they have a watery flow improved between 8 and 9 a.m. So they wake up at, say, 6, something like that, and they're all stuffy and they're tossing and turning. Then they got to get up. They get up, and then by 8 or 9, that stuffiness goes away. Prolapsed rectum after eating. Well, that's interesting. Why when you eat they feel like their rectum is prolapsed, but that's a very interesting symptom. If I heard that, I would probably go for Aristolochia, because I don't know, probably might be some other ones. So you'd look under rectum, then you go to prolapsed, then you go, hopefully there's a subcategory after eating, and that would give you, if you just went under prolapsed rectum, you'd have probably a bunch of remedies. Then if you go after eating, it would narrow the remedies down to make it easier to find which one will work. Rectal weakness. So in other words, they're always having a stool. They can't hold their stools. Just like the incontinence for the urine, they have rectal weakness. So they're probably having much diarrhea, or crapping themselves a lot. So this most likely is in older people, but doesn't have to be. Mucus diarrhea. So they have diarrhea with mucus in it. Hemorrhoids, bleeding between stools. So, they have a stool, now they're going about business, and their hemorrhoids start bleeding, which contains mucus. So they got mucus in that stool. The skin has vericose eczema, which is veins, varicose veins. You don't think of it as an eczema, but it is. Acrocyannitis in young girls, which is a blue tint to the skin. What can be the cause of that? That could be yesterday's medicine. They took that medicine and they turned blue. Burns, also for external liquid extra. Okay, so for burns, you can use this medicine for external, a liquid extract of 15% diluted in 1 to 50 in water. So 15% of this extract in 1 part to 50 parts of water diluted. You put it on for burns. And Aristolochia, clematis, would be and this is in tincture form, would be help with that situation. Stomach, acrid dyspepsia, which is heartburn, basically. Temperature, extreme feeling of chill. So this person's very chilly, and that's where that chill was. I forget where that was. Anyways, throat, discolored yellow dry tonsils. Discolored yellow and dry tonsils, sorry. Discolored yellow. So the throat's got a yellow tint to it. in the back. You open your mouth, and that's another thing. You look back in the throat. Dry tonsils, and they're inflamed. Swallowing is painful, and they have laryngitis. They can't talk. Vertigo with headache in morning. Better, or yeah, worse, leaning forward. So they got that vertigo, and if they lean their head forward, man, they really get dizzy. Okay, let's read some stuff. Oh man, I only got a minute. This should have been a shorter medicine. What do I got to read? Nope, nothing to read. Okay. So they compare these medicines, pulsatilla, in close therapeutic relation, acting on the same type of patient. So that's why I say pulsatilla, sepia, Aristolochia. You'd be considering these medicines in the same sort of category. Calendula, which is also an excellent healing plant. So that's calendula with the burns and stuff. You would use that in Aristolochia. What's the other one? Rest Talks also shows amelioration from movement. So that's why I said Rest Talks would be in there with the Aristolochia clematis. So that is morning medicine. Like I said, I'll put my link in there for Saturday. Whoever shows up, that's fine. I just want to get used to using the Zoom call. So that way, I can start continually using this. I'm making courses in there, putting it in my community. And if anybody wants to learn more about it, I have a little course in there that's free. I got all kinds of free information you can use. Go to my community, which is probably, yeah, it's on this. There's a link for that, but I'll put my link for the Zoom in the comments. So, all right, that's morning medicine. You can age, but you don't have to get old. Yeah, let's send that. Sorry.